I got something to tell you. It's a secret. No, I'm just kidding. It's not a secret. I started playing basketball again. I was shooting with the boys, hanging, regular Saturday, and I felt a sharp pain in my elbow again on my release. And I don't really know what's up with that. It comes and goes every few months. And it's actually something I've been kind of dealing with for a little while now. But I never really got it looked at, never really got treated at. But I never got treated. But now it's actually really hurting. And I don't know why. And it happens on and off. I don't know if any of you guys have a similar experience to that. It kind of just like a shooting kind of sharp pain in my right elbow. And I need help. I need professional, real help.
What's up? I'm walking in. Well, the wait is over. Chiropractor is here. So this guy thinks that he can just jump into basketball after months of not playing and then nothing will go wrong. Spoiler alert, you're older, you're not wiser. So what we're gonna do is stay tuned. We're gonna treat the elbow and I'm gonna go step by step as to what's going on and then potentially why it happened. Okay, so what we've determined is that this fine specimen has what's called elbow tendonitis. So it's basically the tricep muscle and the tendon crosses the elbow joint, is irritated and inflamed, and essentially has like micro tears. That's what a strain, sprain kind of deal is. When you have micro tears in ligaments, which most people, that's their injury. It's repetitive sitting, lifting something, whatever. It's usually like a deeper soft tissue problem. So with just a chiropractic adjustment, it's not going, in my opinion, to do much except for either re-aggravate it or it's just going to take longer to heal because you're not affecting the actual issue. So
Issue in the tissue?
Issue in the tissue. So what I would do is I would increase inflammation to that area to promote healing, especially if you're not moving, it's stagnant. So you're not promoting healing if you're like bedridden from an injury. So you want to like bring a bunch of blood flow through dry needling, Graston techniques, soft tissue work, even movement,
supercharge,
and then
the
lasers.
By powering the mitochondria through laser.
Yep. Or even, ultrasound. Some people like or don't like. That's another whole nother.
And then later you put ice on it to move blood flow away, cycle it through.
If they're in significant pain, sometimes I'll say we can do like contrast therapy where we get heat or pro-inflammatory, and then later we'll do like ice and anti-inflammatory, and then you bring in the adjustment like a couple weeks
to make sure they keep moving in the same.
Yeah, because if you're in pain and you've been in pain, you compensate, right? So one area will tighten to help you protect it from like wanting to move to like feel the pain, and then that creates like a whole nother problem if you've done that for days or weeks, right? So that's what the adjustment and soft tissue work does over time. You'll get the micro tears or the injury itself to heal, and then you get that movement back in to make sure that you don't either re-injure it or you kind of get rid of what you just compensated for. Go sit down.
Straddle up.
So when he shoots for basketball, that tricep goes into full motion.
Extension, yeah. So my shot's a lot prettier, it's like a nice. Yeah, practice is full.
So when that occurs, you're putting that joint at full end range and putting a lot of pressure onto the tendon if it's not conditioned and ready. Did you feel this before?
It comes on and off. Like sometimes I'll go months, even playing basketball and going to the gym and doing stuff and nothing. But once, for some reason, I wake up one day and it sparks and then it's inflamed for a while.
So for all injuries, we always explain there's always a threshold. So when you have an area that's either not working properly, whether there's not a lot of mobility, there's past injuries, stuff like that, this area hasn't been working for a long time. So even though he didn't feel pain before, that doesn't mean it wasn't there. It just means that the other muscles were compensating. Now you're feeling pain because you broke through that threshold. Let's do some treatment to kind of get you back into the swing of things. This is a gua sha tool.
It looks like a shark's fin.
Are you finished? We want to look into soft tissue work. So one of my favorites is basically instrument assisted soft tissue. So you might hear Graston, you might hear Factor, you might hear gua sha. All of these things are relatively similar. Basically we use a tool. So here I've used like a gua sha tool. It's just, some of it's made of steel, some of it's made of jade, some are made from other material, but it assists people like therapists and chiropractors in manipulating the muscle and the tendons and the ligaments around a joint to break up scar tissue, to bring blood flow, and to almost identify muscle knots and areas where, there needs to be some work done. But here I kind of noticed that he had like a grittiness around the triceps tendon. So I really focused on breaking that area up and getting some blood flow and inflammatory properties there to help promote healing. We're doing the chiropractic adjustment. You don't always want to just adjust at the region of complaint. So I look at the elbow, I go into all planes of motion and we adjust there. I'll move down to the wrist and make sure that the carpal bones are moving correctly and there's not a lot of restriction going on, because the forearm, if it has tension, can put pressure on the elbow and vice versa. You can go forward and even, adjust fingers. Thirdly, one of my absolute favorite torture devices is the cupping therapy. So this has been around for, thousands of years maybe. Originally seen in things like Chinese medicine, they use glass cups, but for me, when I work with a lot of athletes or I'm in a fast-paced environment with working with multiple patients, we use plastic cups. What it does is you suction into the cup, pulling up areas around the joint into the muscle belly. And what that does is it separates or kind of brings up the tissue, the skin, the fascia, the muscle itself, to kind of promote more blood flow. And just kind of promote drainage. Edema or swelling or lymph drainage is something that's super important for healing. And you'd be surprised, a lot of people have issues with this, or they don't do things to help promote this. So cupping is a really great thing that I use pretty much daily. And for his injury, it really helped to open up the tricep muscle, and I put him through motion to kind of glide the muscle underneath it. It's definitely not fun when you're having it done, but it's well worth it afterwards. Okay, so how do you feel?
I feel good. It hurt at some points. The shark fins felt really, really interesting.
Yeah.
But I definitely feel kind of more relaxed. My muscles feel like they kind of lost a little bit of tension.
Yeah, essentially we got a ton of blood flow to that area. We worked above and below when it came to adjustments and muscle tissue. And then you've got to let your body heal. So we'll do some episodes, but recovery is just as important as treatment. So people often forget that. But that's essentially a very short version of a treatment for tendonitis, or what we use for tendonitis. Oh, that's
I hope that everybody that's experiencing something similar that I'm experiencing kind of reaches out, maybe leaves a comment. I'm kind of curious to see if I'm the only one experiencing something like this, the only one in the whole wide world. This is something I've been dealing with for a while. I'm pretty sure other athletes can relate. And, give it up to Jenna, Dr. J, for coming through with the treatment.
Yeah, no problem. I'm here all day, every day, if you're in the Miami, Fort Lauderdale area. But a couple things. Number one, you don't always have to be an athlete to have these problems. So definitely go get it looked at if you're having pain. And we're gonna go over some more injuries, broader topics. Leave a comment below, subscribe for more.
Stay tuned.